Every 3 seconds, somewhere in the world, another person over the age of 60 breaks a bone that never should have broken. A hip that shatters from a small stumble. A wrist that cracks, catching a fall that would have been nothing at 40. And when the doctor runs the blood work afterward, the same result keeps appearing again and again. Vitamin D, dangerously low, almost empty. But here is the part that should stop you cold. In a huge number of these cases, the person was not neglecting their health. They were eating well. Some were even taking vitamin D supplements every single day. So how does someone swallowing a vitamin D pill every morning end up with levels so low their bones are quietly crumbling? The answer is sitting in the same medicine cabinet, often on the very same shelf, in a bottle they were told was completely safe. My name is Dr. William, and I have spent more than 15 years studying how medications interact inside the aging body, especially the quiet interactions nobody warns you about at the pharmacy counter. And today, I am going to walk you through 9 extremely common medications, drugs that millions of people over 60 take every single day, that can silently block, drain, or destroy the vitamin D your body is desperately trying to hold on to. We are going to count them down from number 9, the one that flies under almost everyone's radar, all the way to number 1, the medication I consider the single most damaging to your vitamin D status. And I want you to pay very close attention to number 3 because it is handed out to more seniors than almost any other drug on this list, and virtually nobody realizes it is working against their bones with every dose. Before we go any further, I need you to understand why this matters so much, because if you think vitamin D is just about strong bones, you are only seeing a fraction of the picture. Vitamin D is not really a vitamin at all in the traditional sense. It behaves more like a hormone, a chemical messenger that reaches into nearly every system in your body. It controls how well your intestines absorb calcium. It regulates your immune system, deciding how aggressively your body fights off infection and how well it keeps inflammation under control. It plays a role in muscle strength, which is why low vitamin D is so tightly linked to falls in older adults. It influences mood, and researchers have connected deficiency to higher rates of depression in seniors. There is even a growing body of evidence tying low vitamin D to increased risk of certain cancers, cardiovascular disease, and cognitive decline. So when a medication quietly drains your vitamin D, it is not just weakening one bone. It is pulling a thread that can unravel your immunity, your muscles, your mind, and your heart all at once. And here is what makes this so dangerous after 60 specifically. As you age, your skin becomes far less efficient at producing vitamin D from sunlight. A 70-year-old exposed to the exact same amount of sun as a 20-year-old will make only a fraction of the vitamin D. Your kidneys, which perform a critical step in converting vitamin D into its active, usable form, also slow down with age. Your gut absorbs nutrients less efficiently, so your body is already fighting an uphill battle just to maintain normal levels. Now add a medication that blocks absorption or accelerates the breakdown of vitamin D, and you have created a perfect storm. The deficiency builds slowly, quietly, over months and years, with no obvious warning sign until something breaks. Let me show you exactly which medications are doing this. Let us begin at number 9. And please do not underestimate it just because it sits at the bottom of the list. Number 9 is the class of steroid medications known as corticosteroids, with prednisone being the one you have almost certainly heard of. These are prescribed for an enormous range of conditions: arthritis, asthma, autoimmune disorders, severe allergies, inflammatory bowel disease, and dozens more. When you are in pain or struggling to breathe, prednisone can feel like a miracle. But here is what is happening beneath the surface. Corticosteroids interfere directly with how your body processes vitamin D and how it uses calcium. They increase the breakdown of vitamin D in the liver, speeding up the rate at which it is cleared from your system. At the same time, They reduce the amount of calcium your intestines are able to absorb and increase the amount your kidneys flush out in the urine. The result is a triple assault on your bones. This is precisely why long-term steroid use is one of the leading causes of drug-induced osteoporosis in the world. Studies have shown that people on chronic corticosteroid therapy can lose bone density rapidly within the first few months of treatment. If you take prednisone or any steroid regularly, this is not a reason to stop, because for many conditions, these drugs are essential. But it is a powerful reason to talk with your doctor about monitoring your vitamin D and calcium, and about whether a bone density scan makes sense for you. That is number 9. Number 8 is a medication that millions of people take not because they are sick, but because they are trying to lose weight or manage cholesterol. Number 8 is a class of fat-blocking drugs, with orlistat being the most well-known, sold under names like Ali or Xenical. The way these drugs work is actually quite clever. They prevent your intestines from absorbing a portion of the fat in the food you eat, so that fat passes through your body instead of being stored. But here is the problem that nobody thinks about. Vitamin D is a fat-soluble vitamin. That means your body can only absorb it in the presence of dietary fat. When you block the absorption of fat, you also block the absorption of every fat-soluble vitamin along with it, including vitamin D, vitamin A, vitamin E, and vitamin K. So a person taking a fat blocker to improve their health may be unknowingly starving themselves of the very nutrients that keep their bones, eyes, and immune system functioning. If you use one of these medications, the timing of your vitamin D supplement matters enormously. Taking it several hours apart from the fat blocker can help, but this is a conversation to have with your pharmacist or doctor so you get the strategy right. Number 7 affects a system you probably never connect to your bones at all, and that is exactly why it is so easy to miss. Number 7 is the anticonvulsant medications used to control seizures, including drugs like phenytoin, phenobarbital, and carbamazepine. Now, you might be thinking, I do not have epilepsy, so this does not apply to me. But here is what many people do not realize. These same medications are increasingly prescribed for conditions that have nothing to do with seizures, including chronic nerve pain, migraines, and certain mood disorders. So more seniors are taking them than you would ever guess. The problem is that these drugs activate a powerful system in the liver, a group of enzymes that dramatically speeds up the breakdown of vitamin D. Your body converts vitamin D into inactive waste products faster than it can use them. Over time, people on long-term anticonvulsant therapy can develop a condition once called anticonvulsant osteomalacia, a softening of the bones directly caused by the vitamin D depletion. If this is you, regular vitamin D testing is not optional. It is essential. Number 6 is one of the most widely prescribed drugs on the planet, and if you are over 60, there is a very real chance it is in your medicine cabinet right now. Number 6 is Metformin, the cornerstone medication for type 2 diabetes. Metformin is a genuinely valuable drug, and I want to be clear that its benefits for blood sugar control are well established. But the deeper researchers dig, the more they uncover about its quieter effects. Long-term metformin use has been linked to reduced absorption of vitamin B12, and emerging evidence suggests it can also interfere with the way the body handles vitamin D and calcium metabolism. For a person with diabetes, this is especially concerning because diabetes itself already raises the risk of bone fragility and poor healing. Add a vitamin D deficiency on top of it, and you compound the danger. Nerve function, immune health, and bone strength are all on the line. If you take metformin, ask your doctor to check both your B12 and your vitamin D levels periodically. It is a simple blood test, and it can catch a problem long before it turns into something serious. We are now at number 5, and this one is going to surprise a lot of people because it is a medication most think of as completely harmless, almost gentle. Number 5 is the class of cholesterol-lowering statins, with drugs like atorvastatin and simvastatin among the most common. Now here is where it gets genuinely fascinating, because the relationship between statins and vitamin D is complicated. Some early research even suggested statins might slightly raise vitamin D levels, but the more important issue is what vitamin D does for statins and what a deficiency can trigger. Vitamin D and cholesterol share a common origin. Your body actually uses cholesterol as a raw material to manufacture vitamin D when your skin is exposed to sunlight. When you aggressively lower cholesterol, some researchers believe you may be affecting that natural production pathway. But the bigger concern for seniors is muscle pain. One of the most common complaints from statin users is aching, weak muscles. And here is the critical connection. Vitamin D deficiency causes the exact same muscle pain and weakness. Studies have found that people with low vitamin D are far more likely to experience severe statin-related muscle problems, and that correcting the deficiency can dramatically reduce those symptoms. So if you are on a statin and your muscles ache, the answer may not be to stop the statin. It may be to check your vitamin D. That distinction could change everything about how you feel day to day. Number 4 is a medication that people take for their heart, and it is one of the oldest and most trusted drugs in all of medicine. Number 4 is a class of drugs called cardiac glycosides, with digoxin being the primary example, along with certain related heart and blood pressure medications. The connection here works in a particularly dangerous loop. Vitamin D controls calcium, and calcium is absolutely critical for the electrical rhythm of your heart. When your vitamin D is low, your calcium regulation goes haywire, and that can directly affect how a drug like digoxin behaves in your body. Too much calcium fluctuation while taking these medications can increase the risk of dangerous heart rhythm disturbances. But there is another layer. Many heart patients are also taking diuretics, water pills, alongside their heart medication. And certain diuretics accelerate the loss of both calcium and the nutrients that support vitamin D function. The combination creates a situation where the very system you are trying to protect, your heart, becomes more vulnerable because of a nutrient deficiency hiding in the background. This is exactly the kind of silent interaction that regular monitoring catches and that neglect allows to spiral. And speaking of water pills, that brings us directly to number 3, the one I told you at the beginning to watch for. Number 3 is the diuretics, specifically the loop diuretics like furosemide, known by the brand name Lasix. I want you to understand why this one is so important. Loop diuretics are among the most commonly prescribed medications for seniors on the entire planet. They are given for high blood pressure, for heart failure, for fluid retention, for swelling in the legs, and for a dozen other conditions. If you are over 60, the odds that you or someone you love takes one of these are extraordinarily high. And here is exactly what they do. Loop diuretics work by forcing your kidneys to dump large amounts of fluid out of your body through urine. But they are not precise. Along with that fluid, they flush out enormous quantities of calcium, magnesium, and other essential minerals. Calcium is the very mineral that vitamin D exists to manage. So you have a situation where your body is losing calcium at an accelerated rate, and the vitamin D you do have cannot keep up with the demand of replacing it. Over months and years, this steadily drains your bones. Studies have directly linked long-term loop diuretic use to increased bone loss and higher fracture risk in older adults. The tragedy is that so many people take these drugs for years without a single conversation about their bones. They treat their heart or their blood pressure while their skeleton quietly weakens beneath them. If you take furosemide or any loop diuretic, please make bone health part of your regular checkups. Ask about your calcium, your magnesium, and your vitamin D. This is the drug on this list I most wish people understood, and now you do. Number 2 is a medication that hundreds of millions of people take, often for years and even decades, believing it is one of the safest drugs available. Number 2 is the proton pump inhibitors, the powerful acid-blocking drugs used for heartburn, acid reflux, and stomach ulcers. You know them by names like omeprazole, sold as Prilosec, and esomeprazole, sold as Nexium. Here is the mechanism, and it is genuinely important to grasp. These drugs work by shutting down acid production in your stomach almost completely. And while that stops the burning sensation of reflux, that stomach acid is not there by accident. Your body needs it to break down food and to absorb critical nutrients. Calcium absorption in particular depends heavily on adequate stomach acid. When you suppress that acid for months and years, your ability to absorb calcium drops significantly, and this matters enormously for vitamin D because the entire purpose of vitamin D is to help you absorb and use calcium. If your calcium absorption is already crippled by low stomach acid, then even good vitamin D levels cannot do their job properly. Research has connected long-term proton pump inhibitor use to increased rates of bone fractures, particularly of the hip, spine, and wrist. The concern is serious enough that regulatory agencies have issued warnings about fracture risk with long-term use, and yet countless people stay on these drugs indefinitely, often without ever revisiting whether they still need them. If you have been taking one of these acid blockers for more than a year, that is a conversation to have with your doctor. Many people can step down to a gentler medication or address their reflux through other means, protecting their bones in the process. Never stop abruptly because these drugs can cause a rebound surge of acid, but do open that conversation. And now we arrive at number 1, the medication I consider the single most significant threat to vitamin D status in older adults, precisely because it is so common, so long-lasting in its effects, and so completely overlooked. Number 1 is the class of bile acid sequestrants, cholesterol-lowering drugs like cholestyramine and cholestyramine, and I am grouping alongside them the broader problem of any medication that interferes with fat absorption in the gut over the long term. Let me explain why this earns the top spot. Bile acid sequestrants work by binding to bile in your intestines. Bile is the substance your body uses to digest and absorb fats. And as we established earlier, vitamin D is a fat-soluble vitamin that absolutely requires proper fat digestion to enter your bloodstream. When these drugs bind up bile, they do not just lower cholesterol, they can dramatically reduce your absorption of vitamin D, along with the other fat-soluble vitamins A, E, and K. But the reason I place this at number 1 is not just the mechanism. It is the combination of how powerfully they block absorption and how invisibly the damage accumulates. Someone can take a vitamin D supplement religiously every single morning, feeling confident they are protected, while a bile acid sequestrant taken at the same time binds up that vitamin D and carries it straight out of the body before it is ever absorbed. They are, in effect, throwing their supplement away without knowing it. This is why the timing of medications matters so profoundly and why so many people remain deficient despite doing everything they think is right. If you take a bile acid sequestrant, you must separate your vitamin D and fat-soluble vitamin intake from the drug by several hours, and you should have your levels checked regularly. This is the hidden thief at the top of the list. Now, I know that was a lot of information, and I do not want you to walk away from this video frightened or feeling like you should throw out all of your medications. Please do not do that. Every single drug I mentioned today exists because it treats a real and important condition, and for many people these medications are genuinely life-saving. The purpose of this video is not to scare you away from treatment. It is to hand you the knowledge that so many people never receive, so that you can protect yourself while still getting the care you need. So let me leave you with a simple, practical plan. First, if you recognized any of these medications as one you take regularly, especially if you take more than one of them, Make a note and bring it to your next doctor's appointment. Ask directly, could this medication be affecting my vitamin D or my bone health? That single question opens a door that most people never even knock on. Second, ask for a vitamin D blood test. It is inexpensive, simple, and one of the most revealing tests you can run for your overall health after 60. Knowing your actual number takes all the guesswork out of it. Third, talk about timing. As we saw with the fat-related drugs, when you take your vitamin D relative to your other medications can make the difference between absorbing it and wasting it entirely. And fourth, never stop or change a prescription on your own. The goal is always to work with your doctor to find the right balance, the lowest effective dose, and the smartest strategy for your individual situation. Your bones, your muscles, your immune system, and even your mind all depend on this one quiet nutrient, far more than most people ever realize. And the medications meant to help you should never be allowed to silently undermine it in the shadows. Now that you know what to look for, you are no longer in the dark. If this video helped you understand something new about your own health, do me a favor and let me know in the comments which of these medications you or a loved one takes and how old you are. I read those comments and they genuinely shape the topics I cover next. If you found this valuable, consider subscribing here to Dr. William because I break down these hidden health connections every week in plain, honest language you can actually use. Take care of yourself, stay curious about what you put in your body, and I will see you in the next one. Before you go, I want to give you something extra, because understanding the problem is only half the battle. The other half is knowing how to rebuild and protect your vitamin D once you understand what has been draining it. So let me walk you through the practical side of recovery, the part that most videos leave out entirely. Let us start with sunlight, because it is the most natural and often the most overlooked source. Your skin, when exposed to ultraviolet B rays, manufactures vitamin D on its own for free. But as I mentioned earlier, aging skin produces far less of it, so you cannot rely on a few minutes here and there the way a younger person might. The general guidance many experts suggest is short, regular exposure of your arms and face to midday sun several times a week, though this varies enormously depending on where you live, your skin tone, and the time of year. If you live in a northern climate, during the winter months the sun sits too low in the sky for your skin to make meaningful vitamin D at all, no matter how long you stand outside. This is why so many people become deficient in the darker months without ever changing anything about their routine. And I want to add an important caution here, because I am not encouraging anyone to sit in the burning sun for hours. Excessive sun exposure carries its own serious risks, including skin cancer. The goal is sensible, moderate exposure, not sunbathing. For most seniors, especially those taking the medications we discussed, sunlight alone is simply not enough to close the gap, which brings us to diet and supplementation. On the dietary side, there are foods that naturally contain vitamin D, and building them into your meals gives your body a steady supply that works alongside everything else. Fatty fish like salmon, mackerel, sardines, and trout are among the richest natural sources. Egg yolks contain a modest amount. Many countries fortify foods like milk, certain plant-based milks, orange juice, and breakfast cereals with vitamin D, so checking labels can help you find easy sources. And notice something important about those fish. They are fatty, which means they naturally provide the dietary fat your body needs to absorb the vitamin D they contain. This is the natural design working exactly as it should, and it is a reminder of why the fat-blocking medications interfere so profoundly with the process. Now, when it comes to supplements, this is where so many people go wrong, and I want to help you get it right. If you are taking a vitamin D supplement, the form matters. Vitamin D3, also called cholecalciferol, is generally considered more effective at raising and maintaining blood levels than vitamin D2. But here is the piece almost nobody tells you. Because vitamin D is fat-soluble, you should take your supplement with a meal that contains some fat. Taking it on an empty stomach or with a fat-free snack can dramatically reduce how much your body actually absorbs. So many people diligently swallow their vitamin D first thing in the morning with nothing but a glass of water, and then wonder why their levels never seem to climb. A small change, taking it with your largest meal of the day, can meaningfully improve absorption. And if you take one of the medications on this list, particularly the fat blockers or the bile acid binders, separating the timing by several hours becomes absolutely critical, as we discussed. There is another nutrient I want to mention, because it works hand in hand with vitamin D, and that is magnesium. Here is something that surprises even some health-conscious people. Your body cannot properly convert vitamin D into its active, usable form without adequate magnesium. Magnesium is a required partner in several of the enzymatic steps that turn the vitamin D you absorb into the hormone your body actually uses. And remember what we said about loop diuretics at number 3. They flush magnesium out of your body along with calcium. So a person on those water pills may be losing the very mineral that makes their vitamin D work, on top of losing the calcium that vitamin D is meant to manage. This is why looking at nutrients in isolation misses the bigger picture. Your body runs on a web of interconnected systems, and pulling one thread affects all the others. Magnesium-rich foods include leafy green vegetables, nuts, seeds, whole grains, and legumes. And for some people, a magnesium supplement may be worth discussing with a doctor. I also want to address vitamin K2 briefly, because it forms part of this same picture. Vitamin D helps you absorb calcium, but vitamin K2 helps direct that calcium to the right places, specifically into your bones and teeth, and away from your arteries and soft tissues where it does not belong. Some researchers believe that taking high doses of vitamin D without adequate K2 could contribute to calcium ending up in the wrong locations. This is an area of ongoing research, and I do not want to overstate it, but it is one more reason to think about these nutrients as a team rather than as isolated pills. Always discuss combinations like this with a knowledgeable healthcare provider, especially if you take blood-thinning medication, because vitamin K interacts with certain blood thinners in ways that require careful management. Now let me speak directly to something that I know weighs on a lot of people watching this. You may be sitting there thinking, I take 3 or 4 of these medications, and I have been taking them for years. What if the damage is already done? I want to reassure you. The human body has a remarkable capacity to recover when you give it what it needs. Bone loss is not always a one-way street. With proper vitamin D, adequate calcium and magnesium, weight-bearing exercise, and the right medical guidance, many people are able to stabilize and even improve their bone density over time. The first step is simply awareness, and by watching this far, you have already taken it. Knowledge is what transforms you from a passive passenger in your own health into an active participant. The person who knows to ask their doctor about vitamin D testing is in a completely different position than the person who has never heard of these interactions at all. And this brings me to something I feel strongly about, which is the value of a simple conversation. So much of what I have described today gets missed, not because it is complicated or obscure, but because the appointments are short. The doctor is focused on the immediate problem, and nobody thinks to ask the connecting question. Your cardiologist manages your heart, your gastroenterologist manages your stomach, your primary care doctor manages your blood pressure. But who is looking at the whole picture and asking how all of these medications interact with your nutrient status together? Very often, the answer is nobody, unless you become the one who raises it. So I want to empower you to be that person. Write down every medication and supplement you take, including the over-the-counter ones, and bring that complete list to your next appointment. Ask specifically about vitamin D, about calcium, about magnesium, and about your bone health. A good doctor will welcome that question because it helps them help you. Let me also address weight-bearing exercise because vitamin D and calcium are only part of the bone health equation. Your bones are living tissue, and they respond to the demands you place on them. When you walk, when you climb stairs, when you carry groceries, when you do gentle resistance training, you send a signal to your bones to stay strong and to hold on to their density. When you become sedentary, your bones interpret that as a signal that they are no longer needed at full strength, and they begin to weaken. This is why staying active is one of the most powerful things you can do to protect yourself, especially in combination with correcting a vitamin D deficiency. You do not need to become an athlete. Regular walking, gentle strength exercises with light weights or resistance bands, and balance work that reduces your risk of falling can make an enormous difference. And balance matters tremendously because remember, vitamin D deficiency itself weakens your muscles and increases your fall risk. So correcting your levels does not just strengthen the bone, it also makes you steadier on your feet, reducing the chance of the fall that would break that bone in the first place. It is a double protection. I want to circle back one more time to the medications themselves because I do not want anyone to leave this video with the wrong impression. If you take prednisone for a serious autoimmune condition, that drug may be controlling inflammation that would otherwise cause you real harm. If you take a loop diuretic for heart failure, it may be preventing dangerous fluid from building up around your lungs. If you take a proton pump inhibitor for a genuine ulcer, it may be allowing that ulcer to heal. These medications earned their place in modern medicine because they work. The problem is never that these drugs exist. The problem is that people take them in the dark without ever being told about the trade-offs, and therefore without ever taking the simple protective steps that would keep the benefits while minimizing the hidden costs. That is the gap I want to help you close. You can take a medication and protect your vitamin D at the same time. These two things are not in conflict. They only become a problem when nobody is paying attention. So here is your action plan. One more time, simple and clear. Look at your medication list and identify anything from today's 9. Bring it to your doctor and ask directly whether it could be affecting your vitamin D and bone health. Request a vitamin D blood test so you know your actual number instead of guessing. If you supplement, take vitamin D3 with a meal that contains fat and space it away from any absorption-blocking medication. Make sure you are getting enough magnesium and calcium to let that vitamin D do its work. Get regular, sensible sunlight without burning. Stay physically active with weight-bearing movement to keep your bones strong and your balance steady. And never stop or change any prescription without your doctor's guidance. Those simple steps, taken together, can protect you far more than most people ever realize. The reason I make these videos is that I have seen too many people suffer consequences that were entirely preventable, not because the information did not exist, but because it never reached them in plain language they could actually use. You deserve to understand what is happening inside your own body. You deserve to know why your bones might be weakening even when you are doing your best. And now you do. That understanding is a form of power, and I hope you use it to advocate for yourself and for the people you love. If this video opened your eyes to something you had never considered, please share it with someone who takes these medications, because you might be handing them exactly the piece of knowledge that protects their bones for years to come. Tell me in the comments which of these 9 surprised you the most. And let me know how old you are and what medications you take every day, because those comments genuinely guide what I explain next. And if you want to keep learning how to protect your health after 60 in a way that is honest, clear, and rooted in real science, make sure you subscribe here to Dr. William so you never miss the next warning that could change everything for you or your family. Stay well, stay informed, and I will see you in the next video.